Addictions can be devastating to any individual. However, on a developing brain, substance abuse can be devastating. This is because a teenage brain is still developing, and introducing a foreign substance can seriously harm the functioning and processing ability of that brain. This is also in addition to the already harmful effects that these substances can have on the body. However, with proper management of prescription medication and with knowledge of the commonly abused substances and the effects that they have on the teens, we can stop these addictions. What exactly is an addiction? There are many definitions. However, the American Society of Addiction Medication defines an addiction as a primary chronic disease of brain reward, memory, and related circuitry. Dysfunction in these circuits leads to What is an addiction? There are many definitions for addiction, but the American Society of Addiction Medication defines an addiction as a primary chronic disease of brain reward, memory, and related circuitry. Dysfunction in these circuits leads to characteristic biological, psychological, social, and spiritual manifestations. However, I would like to draw your attention to the final part of this definition. That is, the pathological pursuit of reward or relief by substance use. To put this into perspective, these individuals experience an intense physical and psychological craving for the substance they are addicted to. These cravings can cause these individuals to act irrationally despite logical explanation. This is due to an intense yearning to obtain their drug of choice. Addiction's potential impact on teens. During adolescence, the brain is still forming, and introducing substances can seriously impact the brain's functioning and ability to develop. Common substances that are abused by teens are prescription substances, such as opioids and stimulants, or marijuana. This is mostly due to the ease of access that teens have to get these substances, whether through leftover prescriptions that teens have access to through their parents, or through friends who have already obtained these substances. The first substance we will focus on is opioids. Opioids relieve pain by acting on specific nerve cells in the spinal cord and brain. The uses of opioids are for pain, moderate cough, diarrhea, and to treat other opioid addictions. The side effects for short term are drowsiness, constipation, nausea and vomiting, headache, dizziness, confusion, difficulty breathing, euphoria, itching, and sweating. The long-term side effects are increased tolerance, dependence, and withdrawal. The second substance we'll focus on is stimulants. They're defined as drugs that stimulate, excite, or speed up the brain or other parts of the body. The uses for stimulants are to treat attention deficit disorder and sleep disorders. They also increase energy, attention, wakefulness, and alertness. The side effects for stimulants for the short term are individuals have difficulty sleeping, have decreased appetite, have a headache, dizziness, increased heart rate, euphoria, anxiety, nausea and vomiting, and increased breathing rates. The long-term effects are changes in mood, behavior, and show aggression, anger, suspicion, and paranoia. The third and final substance we will discuss today is marijuana. Marijuana comes from the cannabis plant, and the active ingredient in marijuana, as well as other byproducts of the cannabis plant, is tetrahydrocannabinol, also known as THC. Marijuana is used in many treatments, including migraines, sleeping disorders, cancer, chronic pain, and clearly others. However, this is not without side effects. The short-term side effects of marijuana use are sensory distortion, panic, anxiety, poor coordination, lower reaction times, and increased heartbeat. The long-term side effects are reduced resistance to common illnesses, immune system suppression, growth disorders, increased abnormal cells in the body, reduction of male sex hormones, destruction of lung fibers, lesions in the brain, reduced sex capacity, study difficulties, apathy, drowsiness, lack of motivation, personal or mood changes, and inability to understand things clearly. Some final thoughts. Addiction can damage all aspects of an individual's life, including their psychological, emotional, and spiritual being. Also, teens run the risk of not only the physical aspects of this, but also long-term damages that may be permanent. It's imperative that we keep prescriptions out of the hands of our teens. Thank you for your time and consideration. And these are my references. Thank you.